Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to An Impact on Your Health. An Impact on Your Health for every day. Our goal is to have you learn at least one thing to help you live better and longer. An Impact on Your Health, heard each and every Monday morning and Wednesday and Friday morning from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. An Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, we revisit today a friend of ours, newly found friend. First met her back in August, and she wrote a powerful message at the time. Her clinical prowess and expertise allowed her to venture into the subject. At that time, we learned about nasal washings through a device that she put together called NasoPure. I'm talking about Dr. Hanna Solomon, and today she's going to be our guest again. We're well into the school year now, and anxious to see how things have gone with respect to this year and all of her clinical practice. You out there listening to me today, as well as you do each and every Monday, Wednesday, and Friday, have had your own experiences with the cool school kiddies, and whether or not they're your children or your grandchildren. Wondered if you had attempted to use the product, had many questions about the use of it, and find out what we can learn from Dr. Hanna today about what she learned this year. Also going to question her a bit about the vaccine situation. She is a board-certified pediatrician, and I'm interested to see how she handles that issue in her own practice. And so you want to stay tuned today when we hook up with Dr. Hanna, as she likes to be called, right after that first break, and so we'll get to it right at that point. If at any time during our discussion with Dr. Hanna today, you want to call in to ask a question or make a comment, that number, of course, as always, will be 412-825-6262. That's 412-825-6262. Of course, I'll give that number additionally throughout the hour. Now, calendar-wise, let's see what we got coming up and coming for you this month. There'll be a lot of talk, and you'll see in just a moment, a little more talk about, Breast Cancer Awareness Month is here. We're smack dab in the middle of it. I'll have some things to say about it. There'll be some girls that have some things to say about it, too. They're going to be here 1 week from today, talking about the gals from Three Rivers Thermography, talking about thermograms, which I offer out as a great thing in place of mammograms. I took off on the mammogram situation once again this past Friday. I hope you enjoyed it. If you didn't, if I upset you, you please let me know, and I'll be happy to try to respond in kind. But this entire month, breast cancer is making me certainly aware of the foibles of our current system. Anyway, the girls from Three Rivers Thermography will be here with us 1 week from today. Talk about just how you might be able to do breast cancer awareness without any harm to you. Also, next week, we're going to be delving into a device we had, I mentioned on the air. It was just about time that we brought it to the purview of all of you listeners, called a Matrix, a unique device, a device that I use in my pain practice every single day of the week. We've been using it, I'm going to say 6 or 8 years now. And why it never hit to the forefront before in my own mind, I don't know, except I knew it was time well past its date in time, and we had to bring it to you. So we're finally going to have 2 shows on it. We're going to do them back to back. Next Wednesday, we're going to be with Dr. Peter Beltram. Now, Dr. Beltram is probably the single most important person in maintaining the integrity and the standards of the Matrix device, which is, in a nutshell, a way to deliver pain relief and neural blockade without using needles. I know how to use the needles. I certainly appreciate their place and what their place should not be. And on a long-term basis, they really shouldn't be part of a patient's pain program. But here we go, talking about matrix and how you can get nerve blockade, nerve block relief without using a nerve block at all. I'm going to talk about that on Wednesday next week. And then on Friday, getting on the clinical side, I was able to communicate with a Dr. Frank Crusade. He's out here in Akron, Ohio, and he is a anesthesiologist, so he's a colleague of mine. We had never met before. We met on the telephone on last Friday talking about what we both experienced in terms of using the matrix, which he, as a anesthesiologist and quite accomplished neural blockade administrator himself, tends to choose the matrix a lot of times for help out there. So by the time next week rolls around, I hope many of you out there, if you do have a pain problem and you are at a minimum looking for relief, one thing for sure, you'll be able to find it with the use of matrix, and I hope by the end of next week to be able to drive that message home hard enough. The week following, of course, we got Bill Henderson coming to town. I still don't have his advanced information. I hope Sylvia gets it to me. Evidently written a book on cancer therapies, and with that in mind, I'm sure there are alternative cancer therapies. I don't have any other information on the gentleman. Hopefully we'll get some very, very soon. Okay, that's the way the calendar is shaping up right now. Excuse me. None of the news. This issue of Breast Cancer Awareness Month. Heck, forget about the fountain. The entire television set, my entire viewing room yesterday turned pink at 1 o'clock when NFL to the airways. They are squarely behind and they are supporting the entire concept of Breast Cancer Awareness Month. The concept is a wonderful one. I don't want anyone to misread or misinterpret my intention. It is laudable to be able to have a spotlight shown on a terrible medical problem. However, it is a travesty. And how now, after we've had the facts revealed as they have been over the ensuing last 11 to 12 months, on how this sneaky group is maintaining all the fervor, good fervor for awareness, but I'm not so sure for honesty they get anything other than a D-. Anyway, went to the website again because I was looking at the National Breast Cancer Awareness website, the organization. I was compelled to come back to what I did mention the other day, talking about the United States Preventative Services Task Force. And it were those strong recommendations from them last year on November 17th, published in the Annals of Internal Medicine, which really made the very earth shake under organizations like Breast Cancer Awareness because it changed the recommendations. Now, it didn't do so on a whim. It did so based on science, yet emotion is ruling the day here. I have a feeling science, instead of being allowed to flourish, is being quashed. And there's a little blurb. I read it on Friday. I'm going to read it again. This is coming right out of the opening page of their website. The United States Preventative Task Force recent recommendations, we're talking about last November now, on mammograms have created some confusion. Click below to see how the NBCAN, that's the National Breast Cancer Awareness Month, board of sponsor members have responded to set the record straight. And there's a whole host of very prestigious organizations they want you to click on. Each of one, well, American Cancer Society, American College of OBGYN, American College of Radiology, Breast Cancer Network, the list goes on and on and on. I'm just going to bring one thing to your attention today, and then let you stew with it a while, I guess. No, two things. First is there are only 3 recommendations that came out of the breast cancer recommendations from last November 17th. They were recommending against the use of routine mammography in women ages 40 to 49. Heretofore, It had been a regular annual event, and they felt that it shouldn't be done at all. And only twice yearly, every other year, mammography should be performed after the age of 50. That was against what had been practiced for years. It said then, in the second recommendation, it recommends biennial screening mammography for women ages 50 to 74. Okay, I've got that. And then it said, we don't even recommend teaching breast self-examination. The science behind these recommendations was what they could not avoid because the benefit of these studies was not being achieved. I'll read this one passage, and I'm going to let it go for today. I'll mention it again on Wednesday. Here is the passage I think brings reality forward and science forward. You can't refute it. You can get emotional about it, and I believe we saw that all day yesterday with the NFL. The 2009 USPSTF, that's the task force, judged that although women in their 40s and women in their 50s benefit equally from routine screening, women in their 40s, here it is, the statement, folks. Women in their 40s experience greater harms from screening than women in their 50s. The harms assessed by the USPSTF were radiation exposure, false positive, false negative, overdiagnosis, pain during procedure, anxiety, distress, and other psychological responses. And there you have it. And it was based on all of those that they couldn't refute what they had seen and had to change the previously set forth protocols that they themselves developed in 2002. They changed them in 2009. It set into play the controversy of our decade. It still rages, but how did we handle it yesterday? Real slick. The word mammogram didn't even come up. They said breast cancer screenings should be done every year from 40 to 49, avoiding the dastardly word mammogram. And with tongue-in-cheek, they just proceeded and glommed ahead. Hey, more on the subject as the month rolls on. How do you feel about it? As angry as I do? I don't know. We'll find out from you. Hey, let's do this. Take a short break. In a minute, we're going to hook up with a good friend of ours, Dr. Hanna. She's going to be here talking about nasal washings again. Let's find out what's on her mind. Be right back in a moment with her.
That seems to be reasonable amount, but no matter how dutifully you follow the instruction, it just doesn't quite produce the result that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Did your doctor ask you what you need? The recommended 5 servings of fruits and vegetables a day is your busy schedule. What have you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's through the Spirit. The blessings of through the Spirit are now formulated into a delicious product rich in antioxidants and minerals. Your health is more than just a result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith, but through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special commercial offer. Through the Spirit, a blessing. Through the Spirit. The Spirit. 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here at KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Monday version of the show. Welcome back from your weekend, however it went for you. We're now off to races and working on a new week. I know we're going to start out really dreary, folks, so hopefully by Wednesday when we emerge from this, you'll all remember it is Pittsburgh. Shouldn't get upset. We're here today with someone we met not too long ago. In fact, in checking was on August 30th that she was with us. Very timely she came aboard, too, because kids were just at the time thinking about going on back to school, whether they really wanted to or not. But with school comes a thought of kids and returning to school and all sorts of potential sources of infection, allergies, and the like. We had a great message brought to us by a young lady who, well, she's a pro. Me working as a pediatrician for quite a while, graduate from the University of Missouri Columbia School of Medicine in '86, completed residencies, and so opened up her family medical clinic, the Solomon Family Medical Clinic in Columbia, Missouri. She's been everywhere since with a product and a procedure that we just got to talk about a bit. Again, how to bring nasal washings into your realm and make it better for you and your children. I'm talking about Dr. Hanna Solomon, who returned with us today. Let's say good morning and welcome her back. Good morning, Dr. Hanna.
Good morning.
Hey, Dr. Hanna. Yes, it is true. Last August 30th, not too long ago, we did hook up for our first meeting. I said that was timely because I don't know about how things work in Missouri, but our kids were literally being forced back to school right then and there. Well, they're well into school now. You're certainly well into school, too. Your kiddies are certainly increased in terms of what they're showing you this year. Are they starting to show you anything at all with respect to any of the diseases that you're normally used to seeing when kids go back?
Absolutely. Runny nose, chest nose, from things like allergies, of course, which it is a season. And because more children are indoors, the weather getting colder here, it's a little bit chillier, you share more of the germs, and you take them home to your family members who are not exposed, and then your folks and your siblings share it with other people. So it just sort of rolls downhill, so to speak. You just share those germs, and the younger children tend to be spreaders more often, because they don't have that natural immunity. Dr. Courtney, probably you have experienced many times where people will come to your office and you will not get their illness, even though they may have coughed or sneezed within 4 or 6 feet of you. And that's because part of the reason is that you have hopefully a good immunity, but also an age experience, a body detects those germs before, therefore you don't have those symptoms. So, yes, it's a season for that runny nose.
Tis the season. And would you say at this particular, the majority of them are due to allergic response? I mean, as our leaves fall and maybe our pollen alerts go through the roof, we should expect them to decrease, or would you say there's an equal propensity of having viral symptoms versus allergies, or there's just no way to tell?
I don't think there's any way of telling. I think it depends on the person and their personal history. But yes, it is an allergic, but I will suggest to you to consider someone who has allergies then is plugging up the work, so to speak. Plugging up the nose, sinuses, and the ear draining system. If they don't stay clear, they have a fairly good chance of getting secondarily infected.
Well, that is an interesting way of approaching it because I think it leads directly into where your work has taken you with this plugging up, clogging up the drainage systems. Just naturally leads to ask the question with respect to your device or your process of nasal washing, how you find it to benefit your patients.
Well, much like a child that comes home with a muddy cut, nobody would put a medicine on top of the mud without a common sense approach. Let's wash the mud off first. Well, as a physician, it became very obvious to me that the nose was the entrance point for much of our irritant. And the nose is traffic way for the sinuses, ears, back of the throat, asthma, snoring, of many ailments. And therefore, we as humans who are interested in prevention, who are interested in reducing medication use, we should be irrigating the nasal passages. And in fact, it has been done for centuries over Eastern Europe and Asia. It's just Americans now just learning how to irrigate their nasal passages. And over the years, I, of course, taught the neti device that I just referred to. It was like a teapot, but most of the folks weren't really interested in using it on a daily basis because if you don't use it on a daily basis, you might as well use it as a flower pot. And so I developed what I think is a more comfortable way to wash the nasal passages, so comfortable that even 2-year-olds ask to take it because it feels good. If you're walking around with a full stuffy nose, it's not as comfortable. You don't eat as well, you don't sleep as well, you don't pay attention as much. You're not in as good a mood. And so, Dr. Courtney, you and I both took the nose, first do no harm. And so for me, it was very paramount to offer my patients something that could help them use less drugs.
I'll tell you, the little analogy you made a moment ago is one that really sets into the mind if you think about it, washing off the mud. I mean, you would never think of putting medicine on top of the mud. That makes so much sense. Yet it's sort of in a way that parents have dealt with this issue, taken some nostrum, cream, elixir, something to help their child when in fact there's so much crud. The medication couldn't even have gotten to the site of the mucosal lining where it could maybe even done some good because it got trapped in the mud.
Thank you. Here's, during this season, the most common scenario is somebody, a child or an adult, has drippy, itchy nose, eyes. You go to the doctor says you have allergies. The doctor almost always gives you two things. One is an antihistamine pill, which means your entire body gets this antihistamine, when in fact really the nose is the problem. And antihistamine tends to dry things out. And when you dry things out, then the traffic way gets plugged up. You don't want that. But more importantly, they'll offer a nasal steroid, a 1-ounce bottle of a chemical, a steroid that may cost $100. Okay. And they want you to spray the steroid in your nose. Well, what is that steroid doing on top of the mud, so to speak?
Yes.
Well, like on the mucus, you made up to a quart of mucus a day, and if you're allergic, you make more than that. And the last thing you want to do is dry it out, because it'll get plugged up. I suppose that you wash the irritant away, and then use the steroid, but guess what? Usually, if you wash the irritant, you won't use the steroid. You won't use it as much. You won't use it as long. And after you get your Texas with nasal washing down, you won't use it at all. Because studies have shown, these are independent studies, none that I've seen, before because I did not pay for one of those $10 million studies. If you use the right saline mix, it will remove 80% of the 80% of the allergens. Allergens is the word that we use that really the allergy protein in the air that keeps us breathed in that will cause that congestion and that sneezing. 80% of that will be washed away into a supersaturated, salty, but buffered solution. What's also interesting is that super salty, buffered solution will kill viruses.
Huh.
Add enough salt to a viral particle and it will shrink away and die. So during cold season, how wonderful would it be to wash the filter? Guess how much air we use per day? 10,000 liters. That's about 2,000 pesos a gallon. Do you know of any other filter that you use in a machine that you would use for years and years, decades, and never clean the filter?
Never clean it. Such a good point to make, Dr. Hanna. Now, you mentioned that with the advanced information I had back in August, I thought you had keep saying where even a nasal washing, even a 2-year-old can do it. And that sort of rings true with, I thought, what might be an objection on the part of patients, or parents at least, thinking that their kids, oh, well, they could never do that. Could you spend a moment on how you found this to be something that kids at that age could virtually take to this without any problem at all?
One of the wonderful things about children, one of the reasons I became a pediatrician is, they have this pure, open soul when they enter the world. And so at age 2 or 1, they do not have preconceived notion of, you want me to squirt water in my nose? Oh my God, then I'm going to have the feeling that somebody just pushed me into the swimming pool. Oh, that's going to hurt. That's not going to feel good. I'm going to drown. Adults have those assumptions. If you wash in a certain way, you may get a sense of, I'm drowning. But that's why I developed nasal skills, because I am a water wet. I hate water in my nose. How can I ever ask my patient to do something that I myself wouldn't do? So with a 2-year-old, it is a step. The secret is the parent has to learn how to do it, which, by the way, is very easy if you remove the preconceived notion. If you have those preconceived notions, then I suggest you use my instructions in detail, and I give 100% guarantee that it will feel good and you will love that soothing, refreshing feeling. You do not get those other negative feelings. So when you show you're doing it and it feels good, you show your child and they want to do it. Let me try that. I have some videos on my website that folks can look at, watch, and these little children. Or I also have instructions to different age groups on my website, or anybody can email me, or I can talk them through how to do it. I think it is incredibly important to make this a fun and pleasant experience for the child. The very first thing you do is you give the little kid the bottle and let them play with it in the bathtub while they watch mommy or daddy wash their nose out. If it's a 7-year-old boy, for example, all stuff, can't breathe, and it's his first time washing, you want to approach it with, hey, let's have a booger contest. Who has a bigger booger? If you have a teenager or a college child and it's the first time they're washing, then you need to approach them with what flips their switch. For example, hey, I'll share the $20 Coke that you're going to save. If you try this, you will see you like it. Or, you know what, Amy, this will help you keep your breath. So you go to the child's development, and then you approach them in a way that they can understand. Never, never, never force. Never force. never do it to somebody else. If your own self, you control the pressure, the flow, you automatically block the back of your throat by holding your breath. When you do it to somebody else, that is not the case. But it becomes, remember, every parent remembers, and many children remember the blue bulb torture, with mom or dad coming to the baby with the blue bulb in hand, and the kid is screaming. Well, we don't want nasal cure.
Oh, the aspirator.
Yes,
The dastardly blue bulb. I know they talked about, sure.
Yeah. So, getting the nose is easy. It's actually it's very comfortable, and it feels good. It really feels good. It's a little bit like when you brush your teeth after camping, and you haven't brushed your teeth in a bit. It feels good.
I'm having a good sensation about it right now. Just listening to you, Doc. Why don't you tell our listeners this website, the name of the product, the website, and so on, phone numbers, whatever information you can give about how they may find out more about your particular product called Nasal Pure.
NASOPURE, my website. My 800 number is 877-853-7873, and I'm sorry to tell them that they will be on the other line, on the other end, not a recording, unless I'm on the radio with you. But 877-853-7873. My cell number.
Oh, this is the part I love.
My cell number is 573-999-0450.
You're the only one ever to do that, Doc. You know that, don't you?
Oh, you know, how else can we communicate with each other?
Well, I don't know of anybody else who's ever come on my show giving out their cell phone number, but it's just so appropriate to hear you do it because I know that you mean it, and that if anybody ever would have a question about problems they're having with this in this area, you'd want them to call you. You actually want them to. So
I do. I will say I will not give them specific medical advice because I'm not their doctor. I don't have a doctor-patient relationship, and that is illegal for me. But I will be glad to give medical information. I have a lot of years of clinical experience. I've done a lot of research in the area, and so I can share information. I'd like to say two more things which I failed to say. One is my NasoCure is available in one of the Whole Foods in Pittsburgh.
Oh.
And I have a book that I've written on the subject called Clearing the Air One Nose at a Time, How to Care for Your Personal Filter. And it's not available at Whole Foods, but it is available on my website. If anybody wants to read about it. I personally believe information is power. So if you inform yourself, you will be able to make empowered choices for yourself and your family.
Amen to that. I think that's absolutely true. Why don't we do this, Doc? Why don't I take a short break? Come back. I want you to give all those numbers. Once again, folks, if you need to write some of this stuff down, I promise you as soon as we come back, I'm going to ask Dr. Hanna to go through it again, even to give her cell phone number again. Going to get off into a couple other areas that Dr. Hanna promised to talk about too. We're talking about Pure nasal washings from the founder and inventor of that product. Be back in a moment with more with Dr. Hanna.
Want to help your family be healthier? Instead of learning to disguise tofu with what's way, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Through the Spirit is convenient, affordable, and delicious. Even your cooking family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing of your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow. It seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health here on this Monday morning version of our show. We started our week a little gloomy, folks. You knew that. You live here. By Wednesday, things are going to brighten up again. Bright as they are this morning, however, by virtue of our guest, who comes to us with a message of really how to deal with your own as well as your children's ills and ill feeling with respect to nasal clogging. Sounds like something I can identify with. We have Dr. Hanna Solomon here with us today. She prefers to be called Dr. Hanna. You still with us, young lady?
Yes, and thank you for that compliment.
It's just my natural way of responding. As I promised, I'm asking you, please, one more time, because folks have had a chance now to go get something to write with. Please give us all that information once again on how to get the product, how to get a hold of you, and any other pertinent information you want to pass on.
Okay, my cell number, 573-999-0450, and I will be available as soon as I'm off the phone with you. And my 800 number is 277-653-7873. And my website is nasocure, NASOCURE.com. And if they're interested in the product, they can get it the whole foods in Pittsburgh. And I'm interested in sharing information about nasal health. I've written a book on the subject called Clearing the Air, One Nose at a Time, How to Care for Your Personal Filter. And what my focus is educating folks so that they use less drugs, because they are powered to prevention. So, I welcome any questions.
Well, there you have it, folks. If you have a question for Dr. Hanna, maybe back in August you heard us talk initially, and you actually did get NasoPure. If you did, wondering how it's working for you, how about giving us a call at 412-825-6262 and just tell Dr. Hanna how you feel about her product. Of course, you can ask any question. I'll be looking and listening for a knock on the door to let you right on in before our time is up. But we've got quite a bit of time to go here, too, so plenty of opportunity to get in here. In keeping with sort of a philosophy that keeps coming across this airway, Doc, which is your ability to want to get information out, to get people's questions answered. So when it gives out her phone number, obviously expects to get all sorts of questions. I had a question. I brought it up to you before, and as a pediatrician, I'm really interested to hear your perspective on how you handle the vaccine issue in your own practice. I don't know if you're in a practice where people are raising objections to it.
Yes.
I certainly am in an arena that I hear all those objections. In fact, I agree with most of them. Nonetheless, someone as yourself in the profession has to have a way to deal with this to make parents feel good about their concerns. How do you handle it?
Well, I handle it as though I would handle it for my own child. I have 4 children. I question every vaccine that was recommended by the Academy of Pediatrics, and I feel that vaccines should be addressed individually. I think it depends on the child's age, which vaccine we're talking about, and also the family's belief. I have a problem with the Academy recommending all shots for every child all the time. I think that's sort of a herd mentality, and that's how really those decisions are made based on what's best for the entire population and not each zone. And that's not fair. And there are some vaccines that I think are valuable, and there are some that I think are not valuable.
Share with us which ones you might put in either category.
Okay. The HIV, Haemophilus influenza type B. When I was in residency, I saw dozens of children who came into the hospital very ill with that disease and either left deaf or dead. It's a really horrible disease that is preventable with a vaccine. And in this day and age, residents do not see that illness because we vaccine those children. And there is no risk that I know of associated with that vaccine.
With that in mind, knowing the very first vaccine, at least in my area, I don't know about yours, Hep B is one that usually in my area is administered within the first 24 hours of a birth. Is that happening in the Missouri area also? Same thing?
Yes, and I think that it's wrong. Let me tell you why. It's hepatitis C. It's blood-borne or sexually transmitted. I don't know any newborns that are sexually active.
Correct. Good point.
The reason it's given so early is it's the herd mentality of let's vaccine all of the children while we have them in care. Children tend to go to the doctor more often than infants. And then as they get older, they go less often and they're not able to get vaccine. So in and of itself, that vaccine, if you choose to get it, is a good one to protect it from. But I don't think it's necessary to have that early on. And I think the issue you're bringing up is the number of vaccines that we give infants. So hepatitis C is one that personally I would suggest waiting a bit on. I think a newborn doesn't really need it. Another one that I think I personally have lots of issues with is the vaccine it's recommended for 9-year-old girls.
Gardasil.
To prevent,
cervical cancer.
I think here's another example of, I think you need to look at the child, you look at the family, and most 9-year-old girls are not sexually active. It gives them a message that it prevents all sexual transmission. It does not. It only protects 4 of dozens of strains. If you have a young daughter who is sexually active, or you think she is, then that immunize every 9-year-old girl. Again, the herd mentality, I think, is wrong. The other issue that I have with it, and no science really, but my common sense thinking is we really don't know. We need 20, 30 years of studies before we really know how all of these vaccines affect the immunity of a human 30 years down the road, much like allergies.
Sure.
And so I personally think everybody has to make choices based on the information they have at that time. And yes, we're all learning as we go, but to blindly get every shot every time is a mistake. Chickenpox. When it first was recommended, I told my patients, one was, the Academy of Pediatrics tells me that I should get this. Number two, I would not give it to my child until they were at least 5 or by 5, hoping that they get the natural disease, because the natural disease will protect them for life.
For life.
The vaccine, because it's a live vaccine, will only last years. Well, guess what? Years later, they went, whoops, we're having a whole bunch of kids who are older now having, which is a more dangerous thing. 30% of teenagers and adults who get chickenpox actually have to go to the hospital to get very serious cases. And so I personally believe that you should wait on chickenpox to try to get the child to have the disease. Of course, unless there's some underlying reason not to. Okay, so, but in general, the disease is lifelong protection. The vaccine, now we know these two. One, an initial one, and then a booster. Very much like MMR, when it first came out, they just did one, and then they had a bunch of college kids who got measles, which was serious, so then they learned that they could booster. So, again, I think in my practice, the way I approached it is talk. I listened. And we had a conversation, and then we decided. You know, I feel like patients hire me for my experience and my expertise. But in the end, it is the family's decision about which way to go, and I need to respect that.
Boy, do I like hearing that from you. Once they decide, it really is their call, and to give them information to allow them to make it is what we do. But once the decision is made, I think we need to support them.
Right, exactly. And there are many physicians that I know of who will not accept it if they question.
Oh, it's all your colleagues. They won't let them in the parking lot. Shoot them on site, something like that, isn't it, Doc?
Right. And part of that, I have to say, has to do with the pressures that doctors face these days in terms of numbers of patients, how many can you run through in a day, and also the question, how dare somebody question? And I think that is sort of a very old approach. When I was a child, whatever the doctor said jump, my mom would say, how high? And in this day and age, with the internet and the sharing of information, I think it's our job to question.
In the state of Missouri, just for the heck of it, I'm guessing then, in listening to you, you have the ability as a parent to decide. For instance, in Pennsylvania, there's no steadfast rule that by the time you get into school, well, they have a rule saying everybody needs to be vaccinated, but parents have an avenue to pursue here in Pennsylvania that allow them to opt out. Even though they don't know about it, for the most part, there is that option. Is Missouri the same way?
Yes, you need a doctor's note as to why the child should have it.
Oh, you have to have a doctor's note in Missouri?
Yes.
Ah, that's a little onerous. That is different. We don't require a doctor to certify that someone doesn't have to have a vaccine. A parent can do it on their own.
And that's the way it really is.
Yes, I think that is a little onerous. And boy, it's so nice to have you as a doctor. Imagine people come to you from far away because of your open-mindedness on this issue. Because when you are the gatekeeper, of allowing their child to go to school, really, and if they don't want to vaccinate, they wouldn't have any other choice. Do I hear this right?
That's correct. But it's funny. I have a lot of parents who homeschool, and so it wasn't really.
Yeah, it's really not. And I have parents who homeschool because they felt that they had to vaccinate in order to have their child go to school, which is not true in my state. Yet it was such an important issue for them that it was the crowning issue to make them decide for them to do homeschooling, which was based erroneously on wrong information, but nonetheless, that's how strongly they felt about it. My hat's off to them.
Yeah. Homeschool moms that deserve an award.
Oh, they absolutely do. Hey, I asked you something off air. I'll bring it to your attention. I always like talking with a fellow colleague on something I've got an opinion about, and certainly you don't need to share it directly, but we are in, well, not in the middle yet, but we're smack dab at the beginning of a big month, Dr. Hanna. It's called National Breast Cancer Awareness Month. It's perpetrated on us every year with the right idea behind it, that is awareness. But I believe, well, I won't even get into what I believe right now. Nonetheless, it began on October 1st. It'll run the entire month. How do you feel about this issue of National Breast Cancer Awareness Month, and in particular the tool that is being promulgated about as the way you do this awareness is mammography? There are conflicting ideas out there about mammography. Where do you come down? Even though with your patient load, you probably don't have to confront this issue too often.
Well, I do. I'm a woman, and in fact, I've had breast cancer. So it is a very close-to-home issue. Mammograms have some radiation associated with it, but a mammogram is only as good as the clinical evaluation, the patient's self-exam, the patient's history, the mammogram machine, and the radiologist's interpretation of the test results.
Okay, I got all those factors.
Again, it's the herd mentality. I think that blindly saying that every woman from this age on should get a yearly mammogram is probably not the right approach. I think maybe a better approach is every woman at this age consider a mammogram, and every woman be taught a very good way to self-exam. In addition, you really have to look at the family history and their exposures. How long was the adverse result those? Did they have any other supplemental estrogen? And did they breastfeed? And the list goes on. So I think there's a place for mammograms. There's also several other tests. Mammography.
Oh, you said a magic word. You won the. It's like Groucho Marx. You won. What do you know? Are you familiar with? You must be familiar with thermography.
I'm a little. I wish I understood more of the research that's done on it. I know that it's not well accepted. I think it has great potential. I don't think it causes. In every stage of our life and in every step, you have to look at the risks and the benefits of everything you do. And my understanding is that there is no risk to it, and it can be helpful. So why not complement it? Use it as a complementary tool.
Well, I'm going to take that for the moment. And you're in a special club. Your opinion has real value, because unbeknownst to me, I was not aware you're a breast cancer survivor, and I congratulate you on your survivability, Doc.
Well, let me know in about 20 years if that's still true.
Yeah, we'll all keep our fingers crossed. We got some people trying to get at you in these waning moments. Will you take some questions?
Love it.
Hey, come on ahead. You're with Dr. Hanna. Go right ahead. What's on your mind?
Yeah, quick question. You were talking about vaccines from pediatrician standpoint. Can you comment on the MMR and also tetanus and whether or not you go forward with that?
Tetanus and MMR. I know you had questions about MMR before, Doc. What about tetanus?
Tetanus. Tetanus is a vaccine that I personally have never seen any adverse studies on it, and I see some potential for protection. Do you have a personal issue with it, sir, that you can share with me?
You had a reason why you're against tetanus, she asks? Oh, maybe he left us. Maybe he left us. I'm not so sure that he'll be able to respond. But then what about, you mentioned MMR, but let's take it in its context. It's put down in an age group of children that is it one of those vaccines they should have from your perspective, or is age still another factor? We got the autism. I said the big A word there, the big autism thing out there that no comment's been made on, and an attempt to make a link between MMR and autism. How do you feel about all that?
Well, it's a very complicated and issue, and MMR is a live vaccine. It's given in doses, usually 12 or 15 months, and then again right before kindergarten. And I have a theory, but I don't have any scientific proof, but I have clinical proof. I see it in my clinic, and that is in terms of autism. I wonder if children who have misaligned bowels, children who have been on antibiotics because of ear infections or whatever reason, it's changed their bowel flora, and then they get shocked, and then they slowly develop or they lose some social skills. I think part of it's very complicated, but I think part of the issue is the bowels are very protective of toxins, and when we get shots during a time when we're not well, when our immunity and our flora is altered, it may increase your chance of developing autism. I've seen this in my clinic several times.
Thank you for what you've seen. I'll tell you what, Doc, you have in your answer, in your little theory, have congealed a whole bunch of things out there that aren't so theoretical. Sometime I hope to be able to share them with you. We are right at the gong here, Doc. We got to say goodbye. It's so nice to have spoken to you again. Pittsburgh admires you. Keep it up. NasoPure.com is the place to go until Wednesday when we return again. This is Dr. Dennis Courtney with Dr. Hanna saying so long for AM Impact on Your Health.
That's 724-942-3002 for Dennis J. Courtney.